Does everybody who has hip osteoarthritis need to get a hip replacement? It's a question I get asked a lot. Spoiler, my answer is no. But I'm going to explain why in a little bit more depth in this video to give you my insight. Now, people who have hip arthritis struggle massively. You've got to consider the fact that hip osteoarthritis is the single biggest burden on MSK when it comes to hip related problems worldwide. And we know loads about it, but equally hip replacements, total hip arthroplasties are one of the, if not the most successful orthopedic procedure that is out there. But as me, I'm a physio, so you've got to consider this, right? I'm a bit biased because I'm a hip specialist physio, I'm an expert in the field, I've been doing this for a long time. I am a huge advocate, even as a physio, for hip replacements, for total hip replacements. However, what you don't want to do is send everybody for a hip replacement without considering the options. There are so many things that people can do who have hip arthritis that doesn't have to just mean go straight for surgery. Now, look, I've spoken about hip replacements on this channel at length. I've also spoken about who the best people are to go for it, how good they can be, how effective they can be. I'll link a video above now so you can read and watch some stuff in a little bit more detail. What I want to discuss now is specifically, does everybody have to go and have a hip replacement? And like I said at the beginning, no. Why not though? That's the thing, because you've got to consider this, right? Hip health has a wide spectrum. I've said this before, I say it again. Hip health has a wide spectrum. You can have a healthy hip here that has absolutely nothing at all. Fresh, fit, healthy hip. And here you can have an arthritic hip, right? Which is like worst case, end stage osteoarthritis. But you've got different levels of arthritis. You could have severe, you could have moderate, you could have mild arthritis. You can even have like the precursors to it, like bony cysts and edema and bruising. Now those are very different. The problem is sometimes patients will fall into the trap and fall into the situation where you have hip pain, you go and get an x-ray, you get an MRI, you don't get the report explained to you properly. You don't get it educated to you, you don't get explained what's right, what's wrong, what's normal, what's not normal, what should I expect, what should I kind of understand from it. And that's a big problem because people across the world who have absolutely no pain have and will have elements of hip arthritis and they will not know about. It's the same as me having a bit of grey in my beard. People have wrinkles, like that is just part of life. Doesn't mean it's a bad thing, but also you don't know it until you can see it. And you can't see what's in your body until you've got an x-ray, until you've got an MRI, and then these things come to light. So on one hand, you have to consider this. You can have symptoms or you can have radiographical characteristics of arthritis and have no pain at all. So you don't want to hang your hat on the fact that just something on a picture or a screen or an imaging says that you need to use that as your evidence to go and have what's quite a big procedure. The other thing though that you've got to consider is that also there is an abundance that you can do to still help. You don't immediately go pain, arthritic diagnosis, straight to surgery. You can modify and impact your lifestyle first and foremost. And that's when exercise and physio and just being quite physically active can be so beneficial. Arthritis is a complex situation. It isn't just wear and tear. There are so many factors that contribute towards it. And actually what we know about the hip is that it benefits from being active. It benefits from load, exercise, strengthening exercise, cardiovascular, physical activity. These things are absolutely paramount for the hip joint's health. Now, these aren't the things that patients sometimes do because what happens is they get a painful hip, they get told it's arthritic, and then they think, well, if it is wear and tear, and then I go and exercise more, I go for that hike, I go for that walk, I get on that bike, is that not going to wear it down more? Is that not going to accelerate the situation? Far from it. It is almost like the antithesis of what's going to happen. Because realistically, the hip does not like being sedentary. The hip doesn't like being static. That's why some of the key features of an arthritic hip is that people don't like sitting for too long, or getting out of bed in the morning, or getting up from having sat for a long period of time. All these things hurt because the hip doesn't like being static. So it doesn't make sense to then rest it and not do these things, because activity and exercise can help. And there's loads of different adjuncts that you can look into. We've got exercise in whatever capacity is one. Like I said as well, lifestyle isn't just exercise. It's diet, it's hydration. Sometimes some people enjoy and find vitamin supplementation useful, which is, again, hit and miss. Diet could be key here. You've even got like natural things that can support within your diet to help. And that's not my scope. I'm not going to stand here and start telling you to go and take turmeric tablets and this, that, and the other. But you've got to find what works for you, because you have to try and see if you can improve your symptoms. You may not necessarily be able to revert the joint changes. You know, if you've got a severely arthritic hip that is stiff, that is lost range of movement, that you're struggling to move because it's stiff and it's painful, don't get me wrong. You aren't going to be able to reverse those joint specific structural changes, but you may be able to help your symptoms. But then if you take a step back and you're in that middle phase, that mild to moderate, there's so much that you can do, because it doesn't necessarily mean it has to accelerate and significantly progress down the road to needing a hip replacement. There's still a lot that you can do in those early stages to try and mitigate the progression, to try and help and get your symptoms down. And that is absolutely fundamentally key. It gets overlooked too much though. And don't get me wrong, right? Look, I am a huge advocate for hip replacements, for doing them at the right time, for the right person at the right time. But I would never advocate it for someone who hasn't at least tried to manage their symptoms with physio. And I say physio, could be osteopath, could be a sports therapist, just someone who is giving you the right advice. But it has to be the right kind of input. You don't want to be seeing someone, and you don't want to be doing loads of like horrible deep stretches that are irritating the joint, that are pushing it to the end of the range and it to a point where it can't tolerate the things that you're trying to do because it hurts too much, because the joint isn't moving and you're jarring it to the end of its range. You want to see someone that's going to give you things that you can do that are functionally tolerable, that you can do, that are fun, that you like to do and want to do and stay motivated to do. And that's something that we need to consider. But in some cases, like I said, you could do all those things and it still just isn't progressing. And at that point, then you have to start thinking, have I done enough? Do I feel confident enough that if I go to have a hip replacement, that I have tried all the non-operative changes, all the non-operative ways of doing it? Because there is so much that you can do. Hip replacements are great. Hip arthritis is very common, but also it doesn't necessarily have to mean that everybody who has an arthritic hip has to go down the route of having a hip replacement. But if this is you, you're watching this video, you're that individual, you might even be a younger adult thinking, this kind of sounds like me. I really want to hear from you guys. And I've said this before, I want this channel to be a community. I want people to learn from other experiences. I want you to tell me, does this resonate? Does this fit with you? Does it make sense? Are you in that kind of grey zone at the moment, trying to figure out what to do? Let us know. Let's talk in the comments. Comment below. And then hopefully we'll watch you. And we'll watch you? No, you'll watch me in other videos. And see you there.